Welcome to the Pennsylvania Medical Marijuana Program webinar, Insight for those with Parkinson's. My Tree Medicinals Elevated Wellness is presenting today, and thank you to our wonderful presenters, pharmacists, Lex and Victoria. Thank you both, and I'll let you both take it away.
Thank you,
Thank you.
Casey. So yeah, we're from My Tree. That is the medical marijuana dispensary we're part of. So we have a location in Uniontown. We have one in East Liberty, and then one in Greensburg. So a little bit about myself before we get into it. My name's Lex. I joined My Tree in July. I'm a young pharmacist. I graduated from Pitt in 2022, but I have been working towards a career in this industry for many years, or what feels like many years to me, almost 5 years now. So that's a lot in the span of my lifetime. So I'm really passionate about this. And as a Pitt student, like we were really fortunate. We had some opportunities for cannabis education in our curriculum, but most practicing pharmacists, and you'll kind of hear from Tori, most practicing pharmacists haven't been as lucky. They haven't gotten any real formal education on this. So I see a real need for that, like not just for you guys, for the patients, but practitioners like myself. It is a challenge with the lack of research, but that's kind of the fun of it. And I wanted to share that I'm a patient myself, so I struggle with anxiety and depression, and I do take a traditional pharmaceutical for that. I take Wellbutrin, but with cannabis, I've been able to stay on the starting dose. So I can supplement with cannabis, and I haven't needed to progress to benzos or anything like that. I also struggle with chronic pain, and I have GERD, so NSAIDs really aren't good for me. So with cannabis, I've been able to stay off of NSAIDs, no need to progress to steroids or opioids or like a nerve block or anything like that. So it's a personal passion as well as professional for me. And here is Tori.
Thank you, Lex. That's great. I appreciate that background, Lex. I graduated myself in 2014 as a pharmacist from WVU. I was actually at Walgreens in retail management and patient outcomes. So after about 11 years, I took a new direction. I have a passion really for medical marijuana itself. And as Lex was saying, graduating 10 years ago, we didn't have any type of education. Starting My Tree 2 years ago has been so eye-opening. There's so much information out there to be learned. And it's just been a great journey for me. So I feel like myself, I'm definitely still learning about medical marijuana. Lex, I may jump to her for sure. I know she's a subject matter expert. She's helped me. Even this presentation myself is also, a learning curve for myself. So I appreciate the opportunity to be able to put this together and learn a little bit more about Parkinson's disease and medical marijuana itself. So thank you for that.
Okay. Quick outline for today. So we'll do a general overview of the Pennsylvania medical marijuana program. What would be the eligibility criteria for you to get your card? Potential benefits of cannabis for managing Parkinson's symptoms specifically. We'll talk about the different forms of cannabis. We'll give some guidance on dosing, administration methods, safety precautions, that type of thing, and then we'll have the Q&A. Okay, so first, legislation in Pennsylvania specifically. So April 17th, 2016, the MMJ program was signed into law with the understanding that cannabis serves as supportive therapy. So it's rarely ever used first line. It's going to be adjunctive. It's going to be in addition to your kind of first line traditional pharmaceuticals. So it was signed into law April 17, 2016, but the program wasn't really implemented for another 2 years after that. So first dispensary opened in Bethlehem, PA on January 17th, 2018. And the program was designed to improve access to safe and effective cannabis medicine. And I think it's done that successfully. So in 2023, there were 913 patients certified with Parkinson's as one of their qualifying conditions. And that goes into the over 400,000 active patient certifications in Pennsylvania. There's almost 2,000 certifying physicians now. We have 184 dispensaries or storefronts. And then we have 32 grow facilities, and program to date has seen $6.5 billion in sales. So how would you actually obtain your card? First, you'd want to register for the program through the medical marijuana registry, and I've linked to it here. So you could register as a patient and or a caregiver. So if you're someone who's not super mobile, you could have a caregiver attached to your card and they'd be able to actually pick up product for you. So after registering, then you would meet with a physician. And this is the physicians have to be approved by the state. They've taken some like mandatory educational courses so that they're able to actually recommend cannabis for you. It's not a prescription they're writing, it's a recommendation that they make based on you suffering from one or more of the 24 qualifying conditions in Pennsylvania. So we have 24 qualifying conditions right now. Those are always changing. I see about one condition added to that per year. And I did want to add that insurance isn't involved in this industry yet. So the physician consults, they tend to run around $50 to $100. And then in addition to that cost, you'd be paying the state for them to actually print your card. So that's $50 as well. In recent years, they've implemented a medical marijuana assistance program. So if you receive any kind of state assistance, Medicaid, PACE, CHIP, things like that, they'd waive the fee. But with the physician consult, you're going to be paying at least probably $50 to get the card. And it is like a traditional prescription in that it expires annually. So you do need to renew your registration every year, meet with a physician again, pay that fee to the state, and then you'll be reactivated and you'll be good for another year. Oh, I did also want to mention Dr. Timothy Likelighter through AHN, I think is someone maybe you folks are familiar with. He specializes in Parkinson's, but he also is one of those certifying physicians. So if you're already working with him, you could mention to him that you're curious about cannabis, and he's pretty knowledgeable on it, and he'd be able to work with you on that. So that's an option. Okay. So I mentioned that there's 24 qualifying conditions in Pennsylvania. So maybe you're wondering, like, how is it possible that one drug can treat such a wide variety of conditions? And that's because of the endocannabinoid system, or the ECS. So the ECS consists of cannabinoids, cannabinoid receptors, enzymes. So THC is a phytocannabinoid, so it's plant derived. We have naturally occurring, we have endogenous cannabinoids. Our body produces cannabinoids that have a near identical structure to THC. So those are called anandamide and 2-HE, 2-arachidonoglycerol. So those are two naturally occurring cannabinoids in our body, and those would bind to cannabinoid receptors in our body, so CB1, CB2. You can see in the graphic I have here, CB1 receptors primarily located in the central nervous system. CB2 you'll find more in the periphery, but there definitely is some overlap. You can see you'll find both CB1 and CB2 receptors in your pancreas, in your bones. So it's widespread, this system in our body, and that's why it's able to regulate such a wide range of physiological processes, mood, appetite.